We're having a conversation about breast cancer, and we're particularly talking about dense breast tissue and African American women. We're also talking about the U.S. Preventive Services guidelines of 2 years ago that says women should only starting having screening mammograms at age 50. It has caused a lot of consternation in the community. With me are 3 doctors from Yale who are going to tell you why you should stick with the previous recommendations. Tell us, Dr. Shagbar.
So the U.S. Preventative Services Task Force came out with the recommendations to have mammograms every other year starting at 50 and ending at age 74. There is plenty of evidence that mammograms save lives in this time period, but they also save lives in women younger than 50. So we, as well as all professional organizations, came out after the U.S. Preventative Services Task Force with the recommendation that we should continue to have mammograms on a yearly basis starting at age 40.
And now African American women, we know that many African American women younger than age 50 develop breast cancer. We're not sure why.
Right.
And so this recommendation has caused some consternation. Dr. Evans, you're a therapeutic radiologist, and you treat women with breast cancer. What would you say to African American women who might be confused by this, in addition to what Dr. Shagbar just said?
Well, I think, there's often things that the recommendations of the professional organizations can differ from the U.S. Preventive Services Task Force. And we know that we're still catching a lot of women with breast cancer earlier by following the recommendations for women age 40 and over. So we would encourage women to stand by that recommendation, to advocate for themselves. If their doctor agrees with the U.S. Preventative Services Task Force, to have that discussion and say, well, what about having a mammogram starting at age 40? And to really stand up for their health and advocate for their health.
And that in fact they can get a second opinion. If their primary care or their GYN doctor recommends something that they are not comfortable with, they can get a second opinion. Dr. Hooley, as someone who reads those x-rays or look at the mammograms and see what is going on there, what would you say? What do you have to add to what the others have said, particularly for African American women?
Well, in addition to having the mammogram yearly beginning at age 40, I think it's actually important to also do the self-breast exam, because we do see a lot of women who detect their own breast cancers by feeling the lump in their breast in between their yearly mammogram. So I think that if somebody has a normal mammogram and a few months later they feel a lump, they shouldn't say, oh, my mammogram is normal, I'm done. I think that they should really call their doctor and come back to us and we can reevaluate. In addition, I think if a woman's mammogram shows that she has dense breast tissue, I think she should really consider having a secondary screening test with the ultrasound, which is an option to all women in Connecticut.
Okay, we have about a minute and a half to deal with a very complex issue. Many women who have had radiation and chemotherapy and all this, particularly radiation, after diagnosis, later on end up with some kind of gynecologic cancer. Like, what do you have to say about that?
Well, I don't think that there's a strong link between radiation and subsequent gynecologic cancers. Mm-hmm. Certainly there is a small link between tamoxifen and endometrial cancer, uterine cancer.
Yes.
But that risk is very low, much less than 1%. And the important thing about understanding that particular risk is that women who do get an endometrial cancer, in general, it's a very early stage cancer. So when on tamoxifen, the risk is much less than 1% of getting it, and if you were to be one of the unlucky ones who got it, it would be a very early stage cancer. With radiation, there always is a small risk of a cancer from the radiation itself. That tends to happen more than 20 years later down the line, typically in the same area that the radiation was given. But it's a very rare thing, much less than 1 in 1,000 chance, and grossly overridden by the benefit that women get from radiation.
Okay, thank you very much. Thank you. I'm sure this will be very helpful to our community. Thank you very much.